1 in 7 people around you can hear sounds that aren't really there. A constant ringing, buzzing, hissing. While everyone else enjoys silence, their world is filled with phantom noise. If you're one of them, you're not alone, and you're definitely not imagining it. This is tinnitus, and it affects more than 740 million adults worldwide. Here's what's actually happening in your brain, why it happens, and most importantly, 3 scientifically proven ways to take back control. What's really happening when you hear phantom sounds? Tinnitus isn't just random noise in your ears. According to groundbreaking research from Harvard Medical School, many people with tinnitus have what scientists call hidden hearing loss. This is damage to your auditory nerve that doesn't show up on regular hearing tests. When your auditory pathway gets damaged, whether from loud noise exposure, aging, or other factors, cells in your brain's auditory center become hyperactive. Your brain starts generating its own electrical signals to compensate for the missing input from your ears. That's the ringing, buzzing, or whooshing sound you hear, even when the room is completely silent. Research published in JAMA Neurology reveals that tinnitus affects approximately 14% of adults globally. But here's the alarming part. For about 120 million people, this isn't just an annoyance. It's severe enough to disrupt sleep, concentration, and daily life. The prevalence increases dramatically with age, jumping from 10% in young adults to nearly 24% in those over 65. Mass General Brigham researchers made a fascinating discovery in 2025. They found that people with debilitating tinnitus are constantly in fight or flight mode. Their pupils dilate and facial muscles tense involuntarily when they hear everyday sounds. It's as if their brain treats normal sounds like threats. Why traditional treatments often fail. Here's the frustrating truth. There's currently no FDA-approved medication specifically for tinnitus. Despite decades of research, pharmacotherapy has produced disappointing results. Most drugs tested in clinical trials have shown no meaningful benefit. But don't lose hope. While we can't eliminate the phantom sound yet, cutting-edge research has identified 3 science-backed approaches that can significantly reduce how much tinnitus bothers you. Management strategy. 1. Cognitive behavioral therapy, rewiring your response. The most extensively researched treatment for tinnitus isn't a pill, it's therapy. Cognitive behavioral therapy for tinnitus has been validated in multiple systematic reviews and meta-analyses. Here's how it works. CBT doesn't try to eliminate the sound. Instead, it changes how your brain responds to it. A comprehensive meta-analysis of 15 randomized controlled trials involving over 1,000 participants found that CBT produced statistically significant improvements in tinnitus distress. The effect size was substantial when compared to both passive controls and alternative treatments. In one study involving 30 participants with chronic tinnitus, those who received 8 weekly CBT sessions showed dramatic improvements on both the Tinnitus Handicap Inventory and Visual Analog Scale. The control group showed no significant changes. Internet-delivered CBT is making this treatment more accessible than ever. A 2022 randomized controlled trial found that audiologist-guided online CBT reduced tinnitus distress significantly more than weekly monitoring alone. The best part? These improvements were maintained 2 months after treatment ended. CBT teaches you to identify negative automatic thoughts about your tinnitus and replace them with more realistic, positive thinking. It's like training your brain to stop treating tinnitus as a threat. Management strategy. Tier 2. Sound therapy, competing with the phantom. Sound therapy involves using external sounds to make your tinnitus less noticeable. Think of it as giving your brain something else to focus on. Multiple studies have confirmed its effectiveness. Research published in the Journal of Speech, Language, and Hearing Research found that participants who used sound therapy for 3 hours daily over 6 months experienced significant improvements in tinnitus symptoms. The effects were particularly strong during the first 6 months of treatment. A particularly impressive study examined 83 patients who completed a 4-month sound therapy program using hearing loss-matched broadband noise. An astounding 96% of participants attained some relief. The average tinnitus handicap inventory score dropped by 23 points overall, but here's what's remarkable. patients with initially catastrophic tinnitus saw their scores drop by an average of 42 points. Newcastle University researchers recently tested a novel sound modulation therapy delivered entirely online. Participants listened to specially designed sounds for 1 hour daily over 6 weeks. The therapy disrupts synchronized neural activity thought to cause tinnitus. While the average loudness reduction was modest at around 10%, some participants experienced much larger benefits, and the quieting effect persisted for at least 3 weeks after treatment ended. The key is consistency. Research shows sound therapy works best when used for several hours daily over at least 6 months. Management strategy 3. Bimodal Neuromodulation, the FDA-approved breakthrough. This is where things get really exciting. In March 2023, the FDA approved the first-ever bimodal neuromodulation device for tinnitus called Lanier. Bimodal Neuromodulation combines sound therapy with electrical stimulation of your tongue. Yes, you read that right, your tongue. Here's why this works. By pairing sounds with gentle electrical pulses to your tongue, you're activating multiple sensory pathways simultaneously. This creates robust neural plasticity in your auditory brain, essentially rewiring how it processes sound. The clinical evidence is compelling. A large randomized controlled trial published in Science Translational Medicine enrolled 326 participants. After 12 weeks of treatment, participants achieved statistically significant reductions in tinnitus severity. The effect sizes ranged from -0.77 to -0.92, which researchers consider large effects. Even better, therapeutic improvements continued for 12 months after treatment ended. A 2024 study published in Nature Communications examined patients with moderate or more severe tinnitus. When participants started bimodal treatment, 58.6% achieved clinically meaningful improvement compared to only 43.22% with sound therapy alone. Real-world results match the clinical trials. A retrospective review of 220 patients from the Alaska Hearing and Tinnitus Center found a remarkable responder rate of 91.5%. The average improvement on the tinnitus handicap inventory was nearly 28 points, and there were no device-related serious adverse events. The bottom line: tinnitus is frustratingly common and currently incurable. But you're not powerless. Cognitive behavioral therapy can change how your brain responds to the phantom sound. Sound therapy can mask it and reduce its intensity. And bimodal neuromodulation represents the cutting edge of tinnitus treatment with FDA approval and strong clinical evidence. The research is clear. These approaches work. They won't make the tinnitus disappear overnight, but they can dramatically improve your quality of life. If tinnitus is affecting your daily life, talk to an audiologist or ENT specialist who understands these evidence-based treatments. You don't have to suffer in silence. If you found this information helpful, share it with someone who might be dealing with tinnitus. Hit that like button and subscribe to the Pain Story channel for more science-backed health explanations. Your brain deserves to understand what's happening to it.